A patient complains of immense pain whenever the root is infected. The tooth is infected, following which the root gets infected. Why? Now, the reason for this is, if you see these diagrams, the root tip, if you see, is very narrow. So, naturally, the opening will also be narrow. So there are blood vessels which go from the bone, from your jaws, through these narrow openings of this root tip into the tooth. So that is how the tooth gets its nutrition, through these blood supplies. But whenever there is an infection which is coming from the crown, from the tooth, so whenever there is an infection, it infects that small blood vessel, and the blood vessel gets filled up with bacteria and it becomes swollen. So what happens is, the exit of the blood and the blood cells through that narrow opening becomes very difficult. So that is why a patient complains of insulating type of pain, a shock type of pain, whenever his tooth is infected.